I have a pain in the you-know-what, and I am fed up. I'm Dr. Joe Utash with Wellness Key Chiropractic, and every week I meet patients who are just suffering with excruciating pain in their posterior. Butt pain, pain in their hip, pain that travels down their leg, like a sciatica, right? And so I want to go over a few tips that you can do at home and that we recommend to help with your pain in the you-know-what. All right, first of all, I recommend an exam. Right, and so the exam is going to tell me where the pain is actually coming from rather than just giving a blanket solution. So the more specific, the quicker we resolve the issue, right? So the exam is going to tell me, or what we do with the exam is we actually look at the spine itself. We see, is it in its normal alignment? Is the spine straight? Is each one of those vertebrae moving properly? Is the pelvis moving properly? Is the sacrum moving properly? All of these things can contribute to back, hip, butt pain, pain that goes down your leg like a sciatica. Second thing, we do an exam, right? And so if you're not pregnant, I want to see what's going on. So the exam and x-rays, the x-rays that we would take in our office are actually motion x-rays. The spine should be nice and straight from the front. The pelvis should be nice and level. And then when I have you bend to the side and take an x-ray, we should see normal, proper movement in between each or for each of those vertebrae. That'll tell me if, again, that misalignment or stuckness of your spine is causing your pain in the butt. After the x-rays, after the exam, I'd love to go over those with you, but ultimately that's going to lead more likely than not to an adjustment. The adjustment then is going to reestablish motion in the spine, take the stress off the central nervous system, which allows your body and muscles to fire properly, maybe relieving some of the spasms, increasing the motion, and again, motion is lotion, right? After the adjustment, we recommend a few things. All right, first of which is stretching, right? So turn the power on, and then we want to stretch it out. My favorite stretch for piriformis syndrome or for butt pain is this great piriformis stretch. I know there's a lot of different options out there. This is the one that when my butt was hurting, this worked best for me. So putting my foot as high as I possibly can get it, keeping my chest upright, my eyes looking straight across, lifting my leg as high as I can, putting on a chair, maybe on the back of a truck, that type of thing. A minute, maybe 2 minutes on each leg, you're gonna really feel that piriformis starting to open up. That takes some stress off the piriformis, takes some stress off those nerves that run in through there. That's gonna help you with some of that pain. Number 2, lacrosse ball. Right? I love a lacrosse ball. You know, a lot of people use it to use a tennis ball or a golf ball. These ones I find have worked the best. You can buy these on Amazon for a couple of bucks. But ultimately, this solid piece of rubber right here is actually able to, when you put it against the wall, you can really pinpoint those areas that are tender and just kind of lean into them a little bit, right? And you're going to work that for 30 seconds, a minute, maybe 2 minutes. On each side. You can even get up into the lumbar spine. So kind of looking at the posterior, the lumbar spine. We're going to work that with a lacrosse ball. Minute, maybe 2 minutes on each side, right? And then we need to start getting it strong again, right? And so how do we get it strong? We use a vibration platform. This is going to help strengthen up the spine. It's going to feed proprioception or great information to the brain and retrain those muscles to hold it in a better position. And so we'll start out with some basic positioning like so, and then eventually keeping the tummy nice and tight, the core tight, raising up a leg like this. It's going to increase, proprioception to the brain, which is going to help with balance, coordination, and ultimately retraining that body that, you know, having a pain in the butt is not a normal or a good thing. I hope this helps. Again, this is Dr. Joe Utash with Wellness Key Chiropractic.